Hello, this is Welton Gaddy from Charlotte, North Carolina at the Democratic National Convention, and I'm talking with Dr. Rahn Bailey, who is president of the National Medical Association. He's agreed to talk with us a few minutes, gratefully. Tell us a little bit about the National Medical Association you're president of.
Yes, well, we represent the 37,000 practicing African-American physicians in the country. We started in 1895 as a direct result of being unable to join the American Medical Association. We've had a century-long history. I think our primary focus has historically been on providing access and quality of care for all Americans, particularly those who have historically been disenfranchised, but also really protecting, I think, the professional rights of the African-American healthcare practitioner and physician.
Has universal health care been a goal for you, or has it been a problem for your association?
Well, it's been a goal for us for a century. In fact, we take a lot of pride in being, we think, the first medical organization to speak out very affirmatively for the Medicare Act of 1965. So we've been at this for a half century. We strongly supported, during Obama's candidacy, a discussion about health care and full access and equal access for all. So when the law passed, when he won in 2008, when the law passed in 2010, we're very, very happy. We've worked very diligently to get our members involved and trying to be involved in implementation of the healthcare, the exchanges at the state level, and other strategies that need to be employed. We've been, I guess, somewhat disappointed that there's been such resistance to what we think is clearly an overdue concern. Mm-hmm. The reality is we take care disproportionately of a large number of individuals in our society who very often are poor, indigent, disenfranchised, and very often who don't have access to quality care. Because of that, our outcomes are worse. Disparities are much worse. Have early children, infant death syndrome. All concerns that I think mean that our overall healthcare system does not work as well for the African American as for others. Mm-hmm. That needs to change.
Well, I have to tell you that in my own life, since about 1973, I've been working for universal health care, and I frankly don't understand the arguments of those who don't want that. Tell me what you think the problem is and how you address it.
Well, we clearly think as African-American physicians, the problem is that we've had a system that's been two-tiered for a long time, and persons don't want to change. It's been geared toward those who have, and they may receive not only all of the care, but really the highest level care. Very often specialty level services, very expensive care in a boutique-like system, so to speak. And the thought that to bring others into the system, those who had historically been left out, outside the door looking in, will somehow take away from what the average American or the working American with healthcare insurance receives. We disagree with that, but we think that's part of the uphill climb. Mm-hmm. In addition, there's an unfortunate misnomer or misperception by some that there won't be enough physician services, or there won't be enough physicians, if you will, to provide care for all. So by bringing more persons, another 30 million into the system, that'll dilute the system, and then for the average individual who already had care, their waits will be longer, their costs will be higher, all we think concerns that are not accurate. The reality is we take care of all Americans now. If you're poor and have no money, and you show up at any emergency room in our country, we take care of you. And I think people get that. But that's a very expensive way to provide it. We think it's a more labor-laden service, I think, for the physician. We also think it puts the doctor at a greater degree of medical legal risk. Think of persons who not receive good quality preventative care in the first place. All issues that we think will change with an adequate and a representative implementation of the Patient Protection Affordable Care Act.
Dr. Bailey, well said. Thank you for talking with us on State of Belief today.
Thank you very much.
Okay.
Appreciate it.
This is Welton Gaddy. This is State of Belief.